It was chaotic, I would say. It wasn't as planned as it should be. Morale was down. We were cluttered. Staff were demoralised really with the work. There were no clear structure, and I've been able to use that as a structured approach to managing my department and what needs to be done. I found it a good management tool for us because we've never had any visual management kind of technique before within medical records before. We've always gone on and done stuff, but in a bit of a rush, no planning. We couldn't see the wider picture. So for those to bring this on board with his boards and as resource boards, it was a good way that I can manage the department, and also it's good for the staff and my immediate supervisors and managers.
Well, the very first thing really is the engagement of the staff. So we need to energise the staff. They're very demotivated people, and we need to energise them and get them on board with it. When having gone through such delays that they had at the time, not the easiest thing to do. So first of all was try to give them some quick wins to make them feel good about the area and to help them to start understanding the business as well. So effectively they built in a lot of additional processes that they didn't need. Our job was really to start identifying what they were so we could take them out.
The PMO board that we've got to the right of us, this is used on a daily basis, and it means my direct line supervisor, 10 minutes each day, will communicate with the staff, and she'll discuss things like targets to be met that day. She also plans, using the board, the previous day what work needs to be done and what allocation of resource needs to go on each task undertaken in the library. So it's a visual for the staff. They don't no longer have to come and ask. They just go straight to the board and they know what tasks they're doing daily. What you'll also notice is we use it as a planner for when staff are off on sick or any other leave, study leave, annual leave, sickness. So it's easy for when the staff are planning for annual leave requests. They just look at this. If they've enough space, they submit the request. So it's a good visual tool for us, and it highlights any sickness patterns, not only to us but staff themselves. We also use it as a general communication board, and we put general comments about any incidents, health and safety, anything new in the organisation which they need to know about. We open 24 hours a day, and it's always been very hard in the past to get messages or communicate some to all staff. This is the way of being able to do that.
The board has been introduced into other libraries within informatics, and it's been taken up very quickly, and it's though we've never really been without it. It's like a tool that's used every day, and it's very effective in the way that we communicate now. And I think for both good and, you know, when the information's good and we should want to share it, but also when we have to share not so good news, you know, which sometimes is the case, but not very often, I've got to say nowadays.
To be honest, if you're running these boards as they should be, every day for 10 minutes, there's not much pre-work you have to do. The key to it is sustaining these communications when you've time of sickness or annual leave, where this may not seem as priority if you've other clinics. It's keeping this going on a daily basis. At first it was a bit of a struggle, and I'm not lying, it was, because the library, and any medical records library manager will tell you, they are very busy operational areas. So to run the day-to-day norm job, as well as putting all the new things in, can be a struggle. But I would say we started to do improvements within the first 6 months, real big improvements. And then as it gradually went on each week and each month, we saw it better and better, and how it was growing and how we were developing more as a department. And when we managed our key performance indicators to manage our performance, we could tell by that. So it really kicked in. About 6 months for it to embed in, understand what we needed to do, because you've a time limit first to understand where we're at now, where do we want to be. So about 6 months, and then from there it was a surge, it came quicker.
Probably one of the biggest challenges was really understanding where they really were in terms of how the business operated and where they needed to go. As is anyway, when you're first starting an improvement activity, the cry was always, we need more staff. In real terms, we didn't. We just needed to utilise the staff that we got properly. It was trying to unravel that to get the staff to understand what they truly needed. Once we got that buy-in, then it became very much easier.
People have a lot more confidence in the library. Now that can work two ways for this, because we obviously, the aim is to get records back to source and back into the library as soon as possible. That's where they should be. So we've seen a vast increase, something like 40% increase in records coming back to the library since we first started, which means people out within the trust, our customers, our staff, have confidence in us that if they request a set records from us, they're going to get it. I would definitely recommend any department who is going to take on such a big project. The MFS, when we first started off, we did have reservations about how we could actually do this and see it through and be successful. This is been hugely successful in the communication board, so I would advise anybody in any department, no matter what they're working, to, yes, instigate one of these communication boards.
And I think this is a very effective tool, and I think a lot of people have seen how visual it is, and it really helps. It seems to have motivated people and given them ideas for their own departments.
I think one of the biggest legacies that we have in here is that, particularly the management, is they now understand and they can use everything that we've applied here and manage their business with it. So it's not only on a project basis going forward, it's actually truly operational. We're now at a point where all the future projects that they've now got planned, they use all the same PMO style, they use master schedules, etc. But they're all developed themselves now, and they do it as a matter of course, not because I'm there to ask them to do it.